Thank you, Dr. Medekar, for your kind words. I would just make one request. Keep your cell phones down and let it be quiet so that I can think and speak as best as I can. The Dean, Dr. Rawat, Dr. Pathak, my friends on the dais here, I've known them for so long. Faculty members of the college and all administrators of the hospital. Students, colleagues, ladies and gentlemen. The subject of my talk is the changing face of medicine. Time past, time present, time future. Time past is my stint at this great institution where I spent 8 or 9 years from 1948 to I think 56 or 57. Some of the happiest years of my life. I would like to tell you the face of medicine at time past. We had nothing like what you have or what we have right now. Of course we had our eyes, and we had our ears, and we had our hands, and we used them unlike many doctors today. We had the most basic investigations possible in the pathology department. The imaging department was an X-ray. A detailed investigation would perhaps be a barium meal or an intravenous pyelography. This was all. We had, of course, penicillin. Alexander Fleming visited us when I was, I think, in the 3rd year of medical college, a remarkably gentle, humble individual. We had penicillin, we had streptomycin, we had para-aminosalicylic acid and isoniazid, and yes, we had just had chloramphenicol. That was all the antibiotics we had. There were no specialities. Houseman and registrar, we looked after not only the male and the female patients, a huge crowd, but also pediatrics. And I used to dread doing a venesection on the saphenous vein in an infant who was just 1 year old. Those were the days. Those were the days that passed. Medicine advanced more and more, and in 1970, of course, onwards, there was an explosion in the advances of medicine, a great explosion. And come to the present. The great advances in science and technology have completely changed the face of medicine. You witnessed the great miracles, which we would have thought miracles when we were in 1948s and 1950s in this college. I don't have to list them, you know them. Transplant of organs, to give you an example. Numerous medications for numerous diseases. Surgical procedures where the surgeon can put his fingered glove into any nook and corner of the body. Laparoscopic surgery, robotic surgery, name it. I'm not going to list them, you know them. I am going to speak on the other side of medicine, on the darker side of medicine, because I think it's my duty to do so. Roy Porter was a man who wrote a beautiful book on the history of medicine, and the title of his book was Medicine, the Great Benefactor of Man. It's true. I entirely agree. It is true. But there is the other side of medicine. I ask you, why is there such an antagonism, such a distrust and a disillusionment today both with regard to medicine and the practitioners of medicine. You see hospitals burned, you see housemen, registrars attacked by people, you see rampaging people, attacks on doctors and on residents, for example. Why is this so? There is a double paradox here. During my days, the doctor was a subject of great respect. That was a time when science just hovered overhead. And medicine had not achieved much, nothing like what it had today. But yet, the doctor was held in great respect. The medical profession was in great respect, and the repute of the doctor was next to none. But today, when medicine has achieved a great deal, when science has gripped medicine in a tight embrace, we see that the respect for the medical profession is not as great. And the image of the medical practitioner has gone down sharply. Haven't you asked that question of yourself? Why is that so? This is because the science of medicine, the technology of medicine, has for some reason or the other submerged the art within medicine. Medicine has probably strayed a little from its path. It has lost its raison d'etre. Its humanism is humanity. Today I see that the physician relates more to a machine than to his patient. The machine is in between the doctor and the patient. And funnily enough, he makes the patient also relate more to the machine than to himself. The patient comes and says, I've had a headache for 2 weeks, I must get an MRI done. He tells the doctor what to do, and the doctor very readily agrees. Now when that happens, when there is a lack of humanity and humanism in the practice of medicine, the bond between the doctor and the patient becomes feebler and snaps. And the bond between the doctor and patient, particularly in very ill individuals, is extremely important. It is that bond which breeds faith, it breeds trust. And faith, ladies and gentlemen, is important for healing. And more work is being scientifically done today to show how faith acts in the process of healing. You see, unfortunately, because of the great advances in science and technology, current doctors who pass out, are so enamored by them. They are enamored by the sophisticated gadgetry, the gleaming machines, the beautiful views of endoscopies, of MRI machines, CTs, etc. But they don't realize that medicine is learnt at the bedside, that medicine is taught at the bedside. They don't realize the importance of that. You can't learn medicines from machines, however good the machines may be. Please do not misunderstand me. I am all for science and technology. It is science and technology which has given a quantum leap to medicine in our centuries. It is science and technology which has been responsible for the longevity of everyone, not only in Western countries but also in our countries and poorer countries. No doubt about that. But what I want to tell you today, very seriously, that there is more to medicine than science and technology. Technology, for example, cannot take a good history. Nor can technology do a thorough, proper physical examination. Nor can science or technology soothe a patient who is very ill and talk to a patient who is very ill and try and build courage to withstand his disease. Nor can technology take away the anxiety and the worry from the relatives of patients who are very ill. All this, ladies and gentlemen, belongs to the art of medicine. It is the art of medicine which has been submerged by the hubris of medicine and technology. You will ask me, what is this art of medicine? It's very difficult to define the art of medicine. You cannot quantify it, you cannot qualify it. It consists of properties of the mind and heart that empathize with the patient, helping him to get well. Believe you me, it is a forgotten art today. And I only hope it doesn't become a lost art to the distress of both the patient and the medical profession. And if you would ask me, what is the practical aspect of this? How do you practice? It's very simple. History taking is the first art of medicine. And history taking is a completely lost art today. When I am at a loss as to what's happening to a patient, I am telling you this honestly, I go back and back to the patient with a history. And sometimes a chance remark, a remark off the cuff, tells me what probably the patient has. History taking means listening to the patient, talking to the patient, and then questioning the patient. It's important to remember that today, with the way of life we have, many diseases which you think are diseases really originate from a stressed mind. And if you don't realize that, you will never know what is happening to your patient and you will waste a lot of his money. And when you take a history, you should be able to assess, gauge what sort of a person am I dealing with. Is he going to exaggerate his symptoms? Is he underplaying his symptoms? Is he hiding something? These are all very, very important things which modern medicine unfortunately has lost. And following the history, you need to do a good physical examination. That too is a lost art. Nobody does a good physical examination. The cardiologist will examine the heart, but will he take the ankle jerks? No. The respiratory man will look at the lungs, but will he look at the heart? No. A neurologist will examine the nervous system, but will he feel the abdomen or look at the heart again? No. Physical examination is so important. Physical examination is an art and a bit of science. The art lies in the ability to elicit physical signs. The science lies in interpreting those signs. That is so important. Therefore, I beseech you, particularly the students that are here, that you cultivate the sense of sight, learn to feel, learn to hear, learn to touch. And all that you have sensed, sense that within your brains. Think of past experiences and past problems which you have handled in relation to the problem that you are dealing with now. Judge, weigh, and you perhaps might make a proper diagnosis. And unquestionably, ladies and gentlemen, if you ask me, what is the most important thing in medicine? The most important thing in medicine is unquestionably diagnosis. Please remember that. I spoke about the art of medicine. Let me give you my example of what the art of medicine is, because I speak now of situations where the machine does not help, where your modern gadgetry does not help. The art of medicine is being able to pick up an unspoken nuance in the patient's history. It is the ability to spot rather uncommon physical signs, know their significance, signs which no machine can pick up. It is the ability to put the evidence in front of you of a patient and pick up the most likely answer to an important question. It is also the intuitive feel, and the scientists will of course scoff at that. It is the intuitive feel which a good physician has as to what is wrong or what should be done. The art of medicine lies in looking at the patient holistically, not compartmentalizing him into different organ systems as is unfortunately done today. The art of medicine is the art of healing, not just treating, not even just curing. Of course, it is only when art and science join hands that medicine really triumphs. It is only then that a physician can gauge the individual features of a human being so that he can understand what is happening to him. A holistic approach to medicine, to the patient, lends clarity to judgment and prevents him from making difficulties or mistakes. It binds the patient, a good patient bond, doctor-patient bond, a mutually trusting relationship which has existed for centuries, which is hallowed by time. So this is really what the art of medicine is like. I want to now speak a little more about the other side of medicine, the unfortunate side of medicine. The lack of humanity, as I told you, betrays the trust between the doctor and the patient. Now, if this is so for many, many practitioners, it means that the medical profession as such does not relate to society as it should. It does not have the compassion or the humanity that it should. That's the first thing. The next pockmark on the face of medicine is that medicine has become more a business than a profession. And that is the saddest thing that hurts me. It is a business, and it is my mind, it is a nefarious business as that. Money is the root of all evil. Money is the greed that has made the profession this way. Of course, people don't mention it, but you all know in this city there are so many who give cuts to practitioners or to consultants to get practice. That's a disgraceful shame, and I can't see any way of getting rid of it. What is the next pockmark on the surface of medicine? It's the cost of medicine. Tremendous cost of falling ill, particularly the tremendous cost of falling seriously ill. But if doctors remembered that you could make a diagnosis with your eyes, ears and hands and tests which are comparatively simple, if doctors remember that you don't need to a plethora of tests for a simple thing, if doctors remember there are simple, cheap medications for a disease, that they should not necessarily prescribe the most expensive one because it is the most recent one. Then the price of medicines, the cost to the patient would unquestionably be much less. What is the next bookmark on medicine? The next bookmark is the institutionalization of medicine. An MRI machine present, they say in Breach Candy Hospital, is also present in 6 other places in a kilometer radius of just 2 kilometers. What happens? The poor doctor who is managing the MRI machine is told by the dean or by the CEO that what is the matter, you can't get the cost of your machine. So he feeds the machine. He's forced to feed the machine, he'd lose his job otherwise. That breeds unethical practices as well. So you see what I mean? There is a distinct fall in values in the practice of medicine, which was never there in the past. But there is a distinct fall in values in every endeavor, every human endeavor. That's true. So a young bride girl asks me, that's some years ago, how can you have an island of purity when you are surrounded by filth and corruption? Very pertinent question. It's difficult, but it has to be done. Because medicine is not like other professions. It's basically an altruistic profession. And you can't lose sight of that. So for the young boys and girls who are here, I would beg you to remember that. Carry forward the standard of medicine altruistically. That the patient comes first. And everything else comes last. I hope you will remember that. Finally, another bookmark in medicine is this. I don't know if you read Ivan Illich. Any of you have read Ivan Illich, whose first book was Medical Nemesis and the second edition was Limits to Medicine. He says, he's not a doctor. He is a great sociologist in Mexico, but decided to look into medicine. And one of the things, his opening sentence was, medicine has not done good to modern man. And he goes on to prove that. He's read every journal to be read and made sure, absolutely sure of what he's saying. And he considers 3 great sins of medicine. Physical iatrogenesis or medical iatrogenesis. Harm done by drugs, by hospitals and by doctors, and I can't blame that because there are so many poisonous drugs which may sometimes cure and sometimes kill, and it is a bounden duty of the doctor to see the plus points and the negative points when he prescribes such drugs. The second he called is social iatrogenesis. Iatrogenesis means iatros is physician, genesis is to make, made by the physician. Social iatrogenesis. Social iatrogenesis, he says, is really remarkable. He says today the patient for the least thing goes to the doctor. For a cold he will go to the doctor. For the slightest thing he will go to the hospital. That's not good, he said. They should learn to manage themselves. He says social iatrogenesis is bad for society, very good for medicine. And lastly, he calls it a cultural iatrogenesis. That's the cultural iatrogenesis. What is cultural iatrogenesis? Cultural iatrogenesis is something where the modern doctor today insists on keeping the patient alive at all costs, even though making him live is futile or making him live is going to be a great misery for the patient. That is cultural iatrogenesis. A word about the future. Artificial intelligence. Of course, artificial intelligence is of great help, but I've looked at it very, very seriously. Can artificial intelligence innovate? think of something which has never been thought of? No. Artificial intelligence will give you a computerized value of thousands of patients or thousands of things that have happened in life, and will give you a summary of that and will tell you this is the right thing. But can it think of something which has not been thought? And the answer is no. Give me an example, you will say. Yes, I'll give you an example. Take the work of Einstein. Einstein made a thought experiment. He said, if I was sitting on a ray of light leaving the earth, what would happen to me? How would time fare? What will the people look like below on earth? And the second experiment, if a train was passing me and I am standing on the platform, would the time on my watch at the point he passes me be the same as the time of a person there? Can't. These are innovative experiments which have advanced the world. And even in medicine, of course it's important in many fields, but just imagine if you were to take artificial intelligence in a box, went to a patient and say, come on now, tell me what's wrong with the patient. You would be mortgaging human intelligence to artificial intelligence, and you would never be able to pay that mortgage back, ladies and gentlemen. And also remember, even there the human mind comes in. If you're wanting a problem to be solved, you have to get the correct history. That's basic. If you feed the wrong history, it won't work. You have to give the proper physical examination. You must not miss out on anything, otherwise your artificial intelligence will not work. But what troubles me most in the future of this is the work on the genes of the human body. Wanting to change the genes of the human body. We have evolved over millions and millions of years to become Homo sapiens and continue to evolve for hundreds and hundreds of millions of years. And we will perhaps change in the natural course of events. What science is trying to do is to compress that within a few hundred centuries. Rotate the genes, turn the genes, introduce other genes, take out other genes, so that you become a different person altogether. That is indeed frightening. There are numerous advances going on in medicine. I think the single most important thing is to make sure that every future advance is also related to ethical norms in relation to that advance. Without that, we may be doomed. The planet may be doomed. The human race may be doomed. That is so important. If we do that, then perhaps, in future, it will be a new world for us. But if we don't do that, we might sink into a dark age made even more sinister by perverted science. I think I'm going to end, ladies and gentlemen, by speaking a little philosophy. It's amazing how science, spiritualism, and philosophy in modern times come close to each other. I spoke of time present, time past, time present, time future. But remember, according to the great Buddhist, time present is contained in time past and time future, and time future contained in time past. Thank you.